Good evening, everyone. I'm Andrea Foti, and I'm the Deputy Registrar and Privacy Officer here at the RCDSO. Welcome to tonight's session. We're really happy to have you here with us and be able to spend some time on an important topic, professionalism. As all of you know, professionalism is a cornerstone of dental practice. It shapes how dentists interact with patients, make decisions, and contribute to the health of your communities. Tonight, we're going to be exploring the college's new Foundations of Professionalism document. In this session, we're going to do two things. We're going to have a presentation that will take you through the document and outline the content, how we arrived at it, and then we'll have a moderated panel discussion where we'll have three excellent speakers who are going to walk through real-world scenarios related to professionalism and offer some practical guidance and reflection using the Foundations of Professionalism document. To everyone joining us, this session has been approved for 2 points in Category 1. Participants are required to attend the session for at least 75 minutes to get those 2 points. So before we start and really dive into the content, I wanted to begin by sharing a land acknowledgement. And the land acknowledgement is really going to focus on the RCDSO and where it's situated. So RCDSO offices are situated on the traditional lands of the Mississaugas of the Credit, the Anishinaabe, the Haudenosaunee, and the Huron-Wendat peoples. These lands are known to some as Toronto. Toronto is covered by Treaty 13 with the Mississaugas of the Credit, and it's home to many diverse First Nations, Inuit, and Métis people from across Turtle Island. The land is also part of the Dish with One Spoon territory, a treaty between allied nations to peaceably share and care for the land. And as the RCDSO, we accept our responsibility to each other and this land that we live and work on in a spirit of peace, friendship, and respect. We are committed to actively supporting the necessary work towards truth, reconciliation, and equity. And we embrace our role in regulating dentists, in protecting the public interest, and strengthening our partnerships with Indigenous communities to advance access to safe and equitable oral health care. So turning to tonight's session, we have a great group of speakers. And I'm going to be introducing our first speaker, Dr. Erin Walker. Dr. Walker will deliver the presentation I mentioned on the Foundations of Professionalism document, and she will also moderate tonight's panel discussion. So a little bit about Dr. Walker. Dr. Walker is a practicing dentist and owner of a family dental clinic. And that clinic has served her small town community for over 13 years. In addition to her clinical practice, she plays an active leadership role at the RCDSO, where she serves on RCDSO Council. She's chair of the Inquiries, Complaints, and Reports Committee, and she sits on the Executive Committee. And relevant to tonight's discussion, Dr. Walker was also a member of the working group that developed the Foundations of Professionalism document. So she's very well positioned to take you through that and provide you some context. Dr. Walker has a diverse educational background. She holds a DDS from Western University, an MBA, an LLM, and is currently pursuing a PhD in health law. All this while continuing to care for her patients. So she really has a deep commitment to both clinical excellence and professional regulation. She's also a recent recipient of the 2025 Schulich Dentistry Young Alumni of Distinction Award. Very impressive member of our council. We're so fortunate to have her with us tonight. So welcome, Erin, and over to you.
Thank you, Andrea. Hi, everybody. I'm honored to be here tonight, and I'm really pleased to be able to present to you the new Foundations of Professionalism document that we've recently developed. So first off, the presenters tonight have no proprietary financial or other personal interests or relationships relevant to the presentation that could cause a conflict of interest. And all images included in this presentation were obtained from the public domain unless otherwise referenced. So before we get into the new document, I'll give you a little bit of context on where it sits and where it came from and how it was developed. Then I'll give you an overview on what's in the document, and then we'll have a panel discussion where we'll work through a few scenarios, and we'll highlight how these core principles and duties in the document can be helpful in navigating some of the challenging situations that we often face. So context-wise, improving access to care has been a priority of the college for many years. So early work on this issue goes as far back as 2019. There was an access to care symposium where we had a lot of different partners that we engaged with. Access to care was then identified as a strategic project, specifically in the last 2 strategic plans that the college has developed. So our current access to care strategic plan sits under the professionalism pillar in our strategic plan. And the college's objective is to promote a culture of professionalism in dentistry that supports access to quality care, serves the public interest, and upholds public trust. The Access to Care project under the strategic plan has 4 areas of focus. Data, information sharing and education, professional expectations, and collaboration and engagement. So for the last phase of the project, and where we're going to talk about what we're going to talk about tonight, we've been focusing on the last 2, as you see there, professional expectations and collaboration and engagement. You can also find more information about this project on our Access to Care webpage. So if there's any more information you want to know or any questions that we don't cover tonight, that's a good place to check out to start. All right, so with regard to this project, the RCDSO Council directed us to develop professional expectations regarding professionalism and accepting new patients into dental practices. So we decided to develop the Foundations of Professionalism document first. And this is foundational in nature, and it'll help inform the positions in the standards on accepting new patients. So back to access to care, professionalism can help increase access to oral health care by fostering a culturally safe, inclusive, equitable, and accessible environment that is free from discrimination. Improving access to oral health care has a direct connection to the RCDSO's mandate, as you see above, and supports patients' overall health and well-being. So I'll highlight some of the strategies that we use to create this new document when we talk about the process a little bit later. So this slide outlines our key objectives in developing the new document on professionalism. So as I mentioned before, we wanted to update and modernize the RCDSO's Code of Ethics. Foundations of Professionalism is replacing the Code of Ethics and more accurately and comprehensively reflects the current environment. So the intention wasn't to create any new commitments or any new duties or any new rules, but it's simply to reflect the existing commitments and duties and things that we do and uphold every day in our practices. The document is intended to help dentists navigate clinical and professional practice and ethical complexities that we face on a regular basis. It serves as a foundation for all of the college's other standards of practice, guidelines, and advisories. This particular document is high level, but comprehensive in the sense that it covers all of the core principles and duties that dentists have. So the standards of practice and the other college resources will set out more specific requirements on specific areas of practice, like consent, boundaries, or record keeping. Whereas this one, as I just mentioned, is fairly high level and general, and it's meant to serve as a framework that you can draw on to make decisions and to think about situations that you're facing. So to develop it, the working group was struck, and the working group was struck to assist actually with the document of 2 new college resources. So this working group is comprised of dentists and public council members, faculty representatives from Western and Toronto, and subject matter experts. So this was done in a very practical sense, and there was a lot of input that came directly from the chair side on this. So process, the working group used the standards review and development process, which is a template that the college uses to create all of its standards of practice. So this was also used to develop the Foundations of Professionalism document. You can see that we started off by conducting some desktop research, and then we held a public consultation on professionalism back in 2024. So the working group has been meeting since about April in 2024, and we reviewed the desktop research and the feedback that came from the consultation, and we used that information to develop a draft Foundations of Professionalism document. Our council reviewed and approved the draft document to go out again for public consultation in March 2025. So the working group then reviewed all of the feedback we received, which is generally supportive of the draft and very insightful. And we made some minor revisions to the document in response to this. Council then reviewed the revised document in September and approved it as the document of the college. So I'll give you a little bit more detail about the research and the feedback that went into developing this document. So research, we started out with a literature and a jurisdictional review on professionalism. We considered over 40 professionalism documents from other regulators and associations, and many of these have published documents on this topic. We also considered information and data coming from the inquiries, complaints, and discipline matters that have come through the college. On the right-hand side of the slide, you can see different consultation and outreach strategies that we use to obtain feedback from the public and from dentists. In addition to these 2 public consultations I already mentioned, we also consulted with a citizen advisory group, which is a group of patients and caregivers that provide feedback to Ontario health regulators. And we also spoke to attendees at the ODA annual spring meeting. Some of you were probably stopped by the booth, and we probably chatted a little bit about this, and at various conferences as well. We also held RCDSO Connect sessions on this topic, and when we went to the public with our survey, we used an external research firm to poll the public. So our outreach was extensive because we wanted to make sure that we heard everyone's perspective. So now let's look at the document itself. So this is how it's structured. It starts off by giving an overview of the document, and it describes the core components of professionalism that underpin the document. And then it sets out the core principles and duties of the profession. So the overview clarifies that dentists are expected to practice in accordance with the core principles and duties in this document. It also states that these principles and duties are organized by the 4 bioethical principles of patient autonomy, beneficence, nonmaleficence, and justice. And these are pillars that are common in bioethics literature. So the document describes the core components of professionalism as prioritizing the well-being of patients in society and upholding fiduciary duties. Fiduciary duties are things that are set out in law. Fiduciary law governs the legal and ethical relationship between dentists, who are the fiduciaries, and patients, who are the beneficiaries. So some key duties include, but aren't limited to, acting in patients' best interests, acting with integrity, honesty, trustworthiness, and the utmost good faith, avoiding conflicts of interest, protecting patient confidentiality, and providing access to patient records. So the principles and duties set out in this document build on core components of professionalism that we just covered. They reflect dentists' broad responsibilities to patients, society, the profession, and themselves. They represent what patient, society, and dentists consider important based on the feedback that we've received from all of them. And it serves as a framework for dentists' individual and collective conduct. It's intended to help dentists, to help us navigate clinical and professional practice, and to navigate the ethical complexities that are, well, certain to arise, and also to support dentists in maintaining the highest possible level of confidence and trust with respect to patients and society. So the first principle is patient autonomy, which is described as follows. Patients have a right to self-determination, including the right to make their own decisions about their healthcare and to privacy and confidentiality of their health information. So these rights need to be acknowledged and respected by healthcare professions. So the document describes different ways in which dentists can respect patient autonomy. Now, when you'll see these examples are meant to be examples of things that you can do. It's not meant to be an exhaustive list. It's not meant to be a list of things that you have to check off and you have to cover. But these just illustrate and they speak to the overall principles. That's how we intend for the document to be used. So with regard to autonomy, some ways that you could exemplify this are things like obtaining consent for treatment in accordance with legal and professional obligations, providing patient-centered care that upholds the standards of the practice and of the profession. So I'm only highlighting a couple provisions for each principle in this presentation, but I encourage you to read the document so you can familiarize yourself with more of them and with the core principles and duties. The bioethical principle of beneficence means actively serving and benefiting patients and society. So dentists also do good by maintaining and enhancing the health the health and well-being of patients and society, recognizing that both are connected. So the document describes different ways in which dentists can demonstrate beneficence, including things like acting first and foremost for the benefit of patients and in service to their health and well-being, collaborating and communicating effectively within professional relationships and facilitating continuity of care. The bioethical principle of non-maleficence is doing harm to patients and society and protecting them from harm. So the document describes ways in which dentists can demonstrate non-maleficence, including complying with legal, professional, and ethical obligations set out in law and by the college, and by maintaining competence, recognizing our limitations, and referring to other healthcare professionals when necessary. The bioethical principle of justice means treating people fairly and equitably. The document describes different ways in which dentists can demonstrate justice, including complying with legal obligations with respect to human rights and accessibility, promoting health and preventing oral disease by understanding and taking reasonable steps to address some of the determinants of health. For example, by participating in initiatives to reduce some of the health inequities driven by the determinants of health. So an example of this would be participating in different initiatives that do this. So that that could include outreach that you do in your office or outreach that you do on your own, or participating in some of the government programs. Now, I'd like to highlight, before anybody panics or questions, this document does not require dentists to participate in any specific initiatives or programs. These are examples of things that you can do and things that are nice to do, but there are many, many different ways that you can exemplify these principles. All right, we've also developed companion resources to help apply the document to practice and to help patients understand what they can expect from each dentist. So the checklist for dentists is available on our website. And we've also developed frequently asked questions, and we're working on doing some case scenarios to further explain this and flesh it out and answer a lot of the questions that will be coming up. All right, so here's a few examples or illustrations of professionalism in everyday practice. I'm not saying that dentists are required to do all of these things. Many of you are already doing some or all of them. So in this picture, this office is physically accessible with wide hallways, doorways, and spaces to accommodate mobility devices. The office has a calm atmosphere with soothing music playing softly and low lighting in the treatment room. After having a consent discussion about the proposed treatment, the dentist here is reminding the patient that they can stop the procedure for any reason by raising their hand. In the picture, the treatment room has sterilized equipment and all staff comply with IPAC requirements. This office displays local Indigenous art and a 2SLGBTQ+ flag. The forms patients fill out are inclusive and seek to understand a patient's individual healthcare and accessibility needs. The washroom here is inclusive and accessible. The office has anti-discrimination policies, practices, and procedures in place, and staff do ongoing training together on things like cultural safety and trauma and violence-informed approaches to care, so that everybody's aware of these things and knows how and when they can be applied to help patients out. And also this office sometimes offers payment plans to patients who need them. So again, this is just meant to provide some practical examples of how professionalism can show up in your day-to-day practice. But again, I'm not saying that all dentists are required to do all of these particular things. I'll also share with you this photo from Western University, Western Schulich School of Medicine and Dentistry, my alma mater, had a professionalism day in September with first-year students and fourth-year students. And the students were asked to write down one thing they profess to doing to advance professionalism in their own careers. So they're a little bit too tiny to read. So I'll share a few of the examples with you of things that they wrote. Be truthful, listen first, think second, act third, self-reflect, always act in the best interest of patients, treat patients solely based on their needs, do not overtreat, be kind and fair to everyone, treat patients with respect, take time to get to know patients and understand the determinants of health, keep learning and stay humble, seek out help when needed, and seek out mentors. So these examples touch on all of the bioethical principles, and they demonstrate a really strong understanding in the students of the principles and commitment to professionalism. So now let's move on to our panel discussion. So I will be moderating this discussion. So I'm pleased to introduce you to our three panelists for tonight. So we have Dr. Nancy DiSanto, and Dr. DiSanto is chair of the Quality Assurance Committee at the college, where she plays a pivotal role in upholding professional standards and promoting continuous improvement in dental care across Ontario. A graduate of the University of Toronto Faculty of Dentistry, 1994, Dr. DiSanto brings nearly 3 decades of clinical experience and leadership to her role. She's served on the RCDSO committees since 2014. So passionate about lifelong learning, Dr. DiSanto actively engages in continuing education and regulatory innovation, including the development of the college's e-portfolio system. Now, outside of her regulatory work, Dr. DiSanto practices family and cosmetic dentistry in Vaughan and is deeply involved in community philanthropy. Her commitment to excellence and public service continues to shape the future of dental regulation in Ontario. So welcome, Dr. DiSanto. We also have Dr. William Keven Hockley, who is the Associate Director of Clinics and an Assistant Professor of Clinical Dentistry at the Schulich School of Medicine and Dentistry, Western University. Graduate of Western's Faculty of Dentistry, Dr. Hockley brings over 3 decades of clinical, academic, and leadership experience to his role. Dr. Hockley is actively involved in organized dentistry, and he serves various roles with the National Dental Examining Board of Canada, Association of Canadian Faculties of Dentistry, Commission on Dental Accreditation of Canada, and the Royal College of Dental Surgeons of Ontario. He's a fellow of the American College of Dentists and recipient of the ODA's Award of Merit. So welcome, Dr. Hockley. And thirdly, Dr. Bonnie Yu is a dental public health specialist and a fellow of the Royal College of Dentists of Ontario. She is a dental analyst and consultant in the Professional Conduct and Regulatory Affairs Department at the RCDSO, and she is the clinical lead for the college's Access to Care strategic project. So with these panelists, we're going to go through a few different scenarios, and the panelists are going to weigh in on what they would do and how they would use these principles to guide their decisions. So our first scenario. So a patient arrives at a dental clinic requesting the extraction of a molar that causes mild discomfort, but is otherwise healthy and restorable. They explain that they've had previous issues with a tooth and they want it removed to avoid future problems. So when you do the exam and review the radiographs, the dentist finds that the tooth it's structurally sound, it's restorable, and it's surrounded by healthy adjacent teeth. So while the dentist understands the patient's concerns and wants to respect their wishes, they also recognize that extracting a healthy tooth without clinical justification is not within the standard of practice. And it poses some unnecessary risks, such as long-term function and occlusal complications. So the relevant bioethical principles to consider in this scenario are patient autonomy, beneficence, and nonmaleficence. So Dr. Hockley, can you speak to these principles and explain how you would weigh them when you're thinking about what to do?
I'll do my best. Thanks, Erin. I'll humbly offer my perspective. I don't profess to be an expert in professionalism, but I do love this document because I think it serves as a great tool for dentists. So from my perspective, I would look first at the principle of patient autonomy, which is key, as we know. And I think one of the big principles for patient autonomy is the whole concept of consent to treatment. So in this case, we need to provide the patient with all the benefits, risks, alternatives of treatment in order to enable them to make the proper decision. With respect to beneficence, we want to make sure that we do the best for the patient. And patients may come in sometimes sort of asking for treatment they think is right, but they may not be asking for the treatment that we would have if it was our own family member. So we need to, again, make sure that we inform them so that we guide them down the path of making that correct decision and offer them the best treatment possible. The principle of non-maleficence, above all else, we want to make sure that we don't do any harm. In the case of the patient requesting the removal of the tooth, this could be or would be an irreversible procedure that would potentially the patient would carry with them for the rest of their life. And depending on the age of the patient, that could be quite tragic. So to sort of contextualize that from my perspective, I feel that while the patient's ability or our right to, or our responsibility rather to respect their autonomy, we need to make sure that we've informed them properly. I guess another way, one of the ways I would look at it as a general practitioner is if the patient knew what I knew, would they make the same decision that I would make? So if the patient is leaning towards extracting a tooth that I feel is otherwise salvageable, maybe I haven't given them all the facets of informed consent. So one of the areas might be to inform them, to make sure that we thoroughly inform them of what the replacement options are if they choose to remove the tooth. And that includes all the options, but also all the costs that are associated with those options, not just to replace it in the short term, but also long-term costs as far as maintenance, or say in this case, a good treatment option may be an implant or a bridge. What are the ongoing costs of maintaining that bridge or replacing that bridge if should it fail? And depending on the age of the patient, it may fail in the future. And same thing with implant components and maintenance. Is the patient aware of all those costs? So I also feel that as a general practitioner, if the patient is pushing to have the treatment done, then you don't necessarily agree with it because we would want to provide the most conservative treatment, which in this case would be to allow the patient to keep their own tooth, that we need to make sure that we have informed them again of all possible consequences moving forward. So that includes the loss of bone. Are they going to have the same treatment options down the road that they have today? Should they elect to get the treatment out or get the tooth removed? So I feel that I also feel that dentists, senior dentists and junior dentists can use this tool because it offers them the ability to focus on those main principles. And if they do so, it's difficult to go astray, I guess, on the final treatment decision.
Yeah, thank you, Dr. Hockley. My next question was going to be how you would use this document to help navigate this scenario. So you've given a great synopsis of this. And, obviously there's going to be, everybody does things a little bit differently. There's never, well, I don't want to say there's never a right way or never a wrong way, because there are some paths that will get you into trouble for sure. But the main thing is you can use this to think about and to work through the different issues at stake here, and to use this as a template to consider what's at stake based on the principles there.
If I could elaborate a bit on that too, I guess if it was a junior dentist and how they would use it to navigate, as far as beneficence goes, there's the principles stated with respect to considering professional collaboration as well. So if you're not sure about the right decision, it doesn't mean you have to make that decision that day. You can always consult with a senior dentist or a specialist. I think sometimes we want to jump in and accommodate the patient very quickly when time can actually be on our side if we can delay things. The other thing is to maybe provide a very conservative treatment for the patient. If they're talking about discomfort, is there something that we can do temporarily to relieve their discomfort, to buy them some time so that they can go home and think about all the options instead of provide them with additional documentation? If it's going to be an implant, if they want to have the tooth out and they're thinking about replacing it, can we provide them with additional documentation to go home and review that in their own time? So I don't think we have to rush in sometimes, and I think this tool helps the dentist to justify that moving forward.
Very good. Yeah, that's an excellent way to exemplify non-maleficence and to avoid causing harm to the patient. So thank you, Dr. Hockley. Do you have anything else to add on this?
No, I don't think so. I would encourage, I think in moving from my role from a practitioner to being at the school, I think I see huge value in this document for us in teaching in the clinic for clinical decision making as well to new practitioners. So I encourage the new dentists on the call to think about that as a tool to go through and help support them on their decision making, because I know we're going to use it at the school for sure, because it's very, very clearly puts the patient's needs first, puts the patient's autonomy first, above all else, do no harm, and justice are very, core principles that I think anybody can understand, even a beginning practitioner can understand to help them make those decisions.
Absolutely. All right, let's move on to scenario 2. So scenario 2, we have a patient who uses a wheelchair and has limited mobility in their upper limbs. And they arrive at a dental clinic for routine care. The physical challenges make it more difficult for the patient to maintain oral hygiene at home and also to be comfortably positioned in the dental chair. The dentist, well experienced in general practice, has limited experience treating patients with physical disabilities. They feel unsure about how to adapt the clinical setup and treatment approach to meet this patient's needs. During the appointment, the dentist struggles to find a safe and comfortable position for the patient, and feels uncertain about how to communicate effectively and respectfully without making any assumptions or seeming insensitive. So the relevant bioethical principles to consider in this scenario are all of them. So patient autonomy, beneficence, non-maleficence, and justice. So for this scenario, we're going to call on Dr. DiSanto. Can you speak to these relevant principles and explain how you would weigh them while deciding what to do?
Thank you, Dr. Walker. I appreciate it. So one of the most important aspects of this document is that the patient's well-being is priority. the scenario brings to light several important bioethical principles in the context of providing dental care to a patient with a physical disability. Navigating this scenario requires humility, a willingness to learn, and a patient-centered mindset. The dentist's good intentions must be coupled with actions that respect autonomy, do good, avoid harm, and ensure fair treatment, the cornerstones of ethical clinical care. So I'd like to briefly discuss how each principle applies, along with practical considerations for ethically and effectively addressing the situation. So the first principle is patient autonomy, respecting the patient's right to make informed decisions about their own care. How would I apply patient autonomy in this case? The dentist should communicate openly and respectfully, allowing the patient to express their preferences, their needs, and adaptations that have worked well in the past. The dentist should avoid making assumptions about what the patient can or cannot do. Instead, ask clear, respectful questions like, what positioning works best for you during dental treatment? Or, are there any accommodations that can help make the dental visit easier for you? So a key ethical focus here is to ensure the patient is fully involved in decisions and their lived experience is valued as a part of the care process. The second principle is beneficence. It's defined as acting in the best interest of the patient and promoting their well-being. Again, how would I apply beneficence in this case? The dentist must adapt care to suit the patient's needs. This could mean modifying the chair position, allowing more time for the appointment, or using assistive devices. The dentist can also provide advice for adaptive oral hygiene tools that can improve the patient's home care routine. This also reflects beneficence. An important ethical focus here is going beyond just providing care. Ensure that the care actively improves the patient's quality of life and accommodates their specific challenges. The third principle is nonmaleficence. Again, to do no harm. Avoid actions that could cause injury or discomfort. Again, how would I apply nonmaleficence in this case? If the dentist attempts to move or position the patient without proper training or assistance, they may cause physical harm or distress. Non-maleficence requires the dentist to seek guidance or training when unsure, and to avoid risky maneuvers without appropriate support, like, for example, from a trained assistant or a physical therapist. Another suggested opportunity is that the dental practitioner could consider seeking appropriate training in rendering treatment to persons with physical and/or intellectual disabilities as one of their planned continuing education goals. So an ethical focus here is to recognize the limits of one's own expertise. Do I have the knowledge, skill, and judgment to provide safe dental care and to take steps to prevent physical and emotional harm? The final principle is justice. So treating patients fairly and equitably, ensuring access to care regardless of disability or other factors. Again, how would I apply justice in this case? The dentist has an ethical obligation to provide the same standard of care to this patient as to others, not to refer them elsewhere simply due to discomfort or unfamiliarity. The practice as a whole should also assess whether the clinical environment is physically accessible in terms of wheelchair access, adaptive equipment, and inclusive policies. So once again, an important ethical focus to consider is to promote equality in access to healthcare and treatment. Disabilities should not be a barrier to receiving competent care. So in considering this case, other practical recommendations for the dentist to think about should include engage the patient in a collaborative dialogue about their needs and preferences. Consult resources on adaptive dentistry or consider referring to a specialist in special care dentistry if truly necessary, but not as default. Request assistance from clinical staff or arrange for training on accommodating patients with physical disabilities. And lastly, document the patient's preferences and needs for future visits to build continuity of care.
Thank you, Dr. DiSanto.
You're welcome.
Great discussion on the principles. Can you give some advice or give some tips on how the new Foundations of Professionalism document helped you to get to these suggestions or tips or this action plan that you would implement in your life?
Sure, thanks, I will. So the Foundations in Professionalism document, for me, modernizes and clarifies expectations of professionalism for dental professionals. When applied to caring for a patient with a physical disability, the guidance can help dentists navigate challenges and deliver care that is inclusive, respectful, and ethically sound. So, there's an emphasis on patient-centered care. The guidance provided by the document places strong emphasis on tailoring care to individual needs of the patient. For a patient with physical disabilities, this means adapting communication, treatment plans, and practice accessibility to ensure that the patient is fully involved in decisions about their care. So that's one aspect that I looked at. Promoting equity, diversity, and inclusion. I feel that the guidance document highlights the importance of treating all patients fairly without discrimination. And in its application, dentists are encouraged to proactively remove barriers, physical or attitudinal, that may hinder a patient with a disability from receiving care. Effective communication. The guidance document encourages clear, compassionate, and adaptive communication based on individual needs. For patients with speech or mobility challenges, dentists might use written communication, visual aids, or involve caregivers or interpreters where appropriate. And there's a nice idea about shared decision-making where the guidance document stresses collaboration with the patient in care planning. Patients with disabilities should be fully involved in decisions with reasonable adjustments made to support their understanding and autonomy. And so in summary, it basically equips dentists with a values-based framework to deliver equitable, inclusive, and person-centered care, reflect on and adapt their practices to meet diverse patient needs. It helps us to engage in ethical decision-making. And lastly, it upholds trust and professional integrity, especially when working with vulnerable populations.
Wonderful. And do you have anything else to add or any other comments or tips for everybody?
I think this document is a wonderful addition, and I support Dr. Hockley. I think it'll be of benefit, in the clinical setting for our new registrants that are upcoming. I think it sets a wonderful tone, and I'm excited to see how the document is upheld in our profession. So thank you. Great work.
Thank you. Thank you. All right, so moving on to scenario 3, where we're going to call on Dr. Yu to weigh in. Over the past year, a dentist has begun noticing troubling patterns in a colleague's behavior. Several patients have shared that they felt dismissed or disrespected during appointments with this colleague. They also reported feeling pressured to proceed with expensive treatments. When patients asked about simpler or more affordable alternatives, the colleague would respond that the proposed treatment was already the best option for them. So the relevant bioethical principles to consider in this scenario are patient autonomy, beneficence, and nonmaleficence. So some questions for Dr. Yu. First of all, can you speak to these relevant principles and explain how you would weigh them when deciding what to do?
Thank you, Dr. Walker. So in this scenario, we have a dentist contemplating what to do when a colleague is exhibiting troubling behavior. First, I'll talk about the colleague's behavior. It appears from the scenario that the colleague is not respecting patients' autonomy, as they're not engaging in shared decision-making. They're essentially unilaterally deciding for the patient what is the best treatment for them. And this brings up the issue of informed consent. When patients express doubt about if they've chosen the correct treatment option for them, it could be a sign that the colleague is not fully explaining all the available treatment options and giving the pros and cons of each. The colleague also does not appear to be demonstrating beneficence, as they're not providing a safe environment for patients to express their feelings, opinions, or concerns. Thirdly, the colleague does not appear to be demonstrating nonmaleficence, and they may not be ensuring patients' best interests remain paramount. They perhaps are not managing conflicts of interest if they are solely presenting the most expensive treatment options. As such, the colleague may not be complying with the legal, professional, and ethical obligations that are set out by the law and by the RCDSO, especially with regards to informed consent. Now to turn back to the dentist. The dentist has the difficult task of weighing the importance of these bioethical principles. Regarding patient autonomy, the dentist must consider if the colleague has taken the time to fully explain all the treatment options, as well as the disadvantages and the advantages of all the options. As dentists, we tend to develop scripts. So if there's a certain clinical situation, we give the options, run through them, and hopefully the patient will decide the option that will best restore their occlusion to full function. But sometimes just pausing and letting patients absorb the information might be helpful. Sometimes it's just too much for them to take in, and allowing them to have time to ask questions and to clarify things. If the colleague is persuading the patients to take the most expensive treatment options, then they may not be considering the other factors that are involved. In the document, the Foundations of Professionalism document, we have the concept of patient-centered care. And patient-centered care is care that is responsive to patient preferences, values, beliefs, or economic factors, as well as other factors. And it appears that the colleague is not engaging in patient-centered care if they're just making the decisions for the patients themselves. Also, regarding beneficence, the dentist must question if the colleague is acting, first and foremost, for the benefit of the patient's health and well-being. Has the colleague gained the trust of the patients, or are the patients being left feeling dismissed, disrespected, or confused about treatment options? Are they feeling left more confused or anxious about how to proceed? And this leads us to the overarching question: should the dentist raise their concerns about the colleague's troubling behavior? The Foundations of Professionalism document does state that one of the duties of nonmaleficence is raising concerns about inappropriate, unprofessional, or otherwise concerning behavior of staff or colleagues directly with the person, or if needed, with the relevant leadership or authority. As this is a very complex and very delicate situation, I would advise the dentist to seek out more information. As dentists, we are taught to be very collegial and not to criticize others' work. But as presented, the colleague may not be following the bioethical principles. I would ask questions about the patient experiences. Has the colleague been using disrespectful language or tone? What other things that are that the colleague is doing that are disrespecting the patients? One other consideration is the relationship of the dentist and the colleague. Are they on good terms? Would the dentist be comfortable with bringing up these concerns with the colleague themselves? Sometimes I imagine the colleague might not even be aware of what they're doing. They might not understand that their words will come across as disrespectful or dismissive. And sometimes just a simple conversation may point out certain aspects to the colleague. And in that case, they might be able to make the change. But in other cases, of course, it is more complex and simple conversation won't help. In that case, if the dentist is not comfortable with having a conversation with the colleague, perhaps they can seek out other colleagues or office staff that they feel comfortable with confiding in. If they can't find other colleagues or staff to confide in, perhaps they can reach out to the college's practice advisory service for advice. I would also like to point out that there is nothing wrong with soliciting the advice or opinions of others, especially with difficult ethical situations. And I would like to end with echoing our other panelists that the professionalism document is not meant to cover all clinical scenarios, but it's meant to aid dentists in navigating these difficult ethical dilemmas, and hopefully it'll give some important points for the dentists to self-reflect and implement in their practice. Thank you.
Thank you, Dr. Yu. That was a very, very comprehensive answer. So let's move on to a closing question. Now it's we have a little bit of time left for some storytelling. So I'm going to ask the other three dentists, and I can weigh in maybe a little bit later if there's time, but can you tell us about a time when you or someone you know has struggled to make a decision? And how do you think the Foundations of Professionalism document could have helped in that scenario? So let's start, let's go with Dr. DiSanto first.
Okay, thank you. Thank you. So I'll share a bit of a brief background of a scenario, and then I'll just walk through it. So Dr. A general dental practitioner, is scheduled to see a new patient, S, who uses a wheelchair and has limited mobility due to cerebral palsy. The practice is on the ground floor, but the surgery room has limited space and has no hoist or adjustable chair. Dr. A is unsure if they can safely and effectively treat S in the practice or if they should refer S to a specialist service. So Dr. A feels torn. Dr. A wants to help S and not make the patient feel excluded or discriminated against. Dr. A is concerned about the patient's safety, proper positioning, and whether treatment can be done effectively. Dr. A worries about appearing unprofessional or unwelcoming if they decline to treat S. So how would the new Foundations of Professionalism document help? So maybe without the document, Dr. A may have made a rushed or emotional charged decision, either treating the patient unsafely or turning S away without explanation. With the guidance document, Dr. A has a clear values-based framework to assess the situation fairly and safely, communicate openly and respectfully, take responsibility while ensuring the patient gets appropriate care, and also to learn from the experience to improve future care. And that's how I like to share a real life situation. Didn't happen to me, but a colleague of mine.
Thank you.
You're
Dr.
welcome.
Hockley, how about you? Have you had anything like this happen to you or a colleague?
Well, I could pretend that it was a colleague, but it was actually me. So I would say that a lot of dentists experience a situation where a patient comes in, particularly when they're in pain. And it's difficult to honor all the principles of professionalism. I feel that a patient's decision-making may be skewed a bit when they're in pain. So a situation where a patient came in with a painful lower incisor that I was pretty sure my diagnosis was that if I opened the tooth up, they would be comfortable. But they're insisting on me removing it. And even though I attempted to convince them that that probably from a beneficence and a non-maleficence perspective was not in their best interest, they insisted upon me doing it. So I was able to convince them through proper informed consent, collaboration, and open discussion about all the risks, benefits, etc., to at least allow me to open the tooth to get them out of pain, so that they could maybe make a more informed decision. So I think the message is people who are in pain, it's difficult for them to make that decision. So the document, I think, would support me in the sense that I'm not removing the patient's autonomy by saying, you know, you have to do what I want you to do. I'm just saying, let me buy you a little bit of time so that I can then make sure that they benefit from their treatment decision and don't make a decision that they potentially could regret later on. So I feel that these principles, again, particularly, and it kind of applies to the scenario that I had, the patient's insisting on removing the tooth, but they can't go back once they remove it. So I just feel that embracing these foundations and reading through a lot of the points, so we only touched on a few of them, but if you read through the entire document, I feel that dentists would be more comfortable making some of these or assisting the patients with making some of these decisions. So don't rush into it. Get the patient comfortable. You can always have them back, and or beneficence again is also, there's the opportunity to refer as well should you feel that that's more beneficial to the patient.
Now we have a really good follow-up question posted through the chat. So for your scenario, if you've explained everything to the patient, given them time, and they come back to you and they still want to take the tooth out, and you still don't think it's in their best interest, what would you ultimately do?
So I think if everything's documented properly, then technically it would be up to the dentist if they feel comfortable doing that the patient is making the decision and they're honoring their autonomy, then I think that's an acceptable way to go. Personally, I probably would not do it. If I feel that I am harming the patient, and the patient isn't completely grasping the consequences, the long-term consequences to the dentition of removing a tooth that could otherwise be saved, I would have to just say, I'm sorry, I'm going to need you to seek treatment elsewhere. And that's maybe a personal approach, but that's the way I've approached it in my practice. I just have to believe that I'm not going to harm that patient. And so there's that battle. And I think that's what's kind of neat about the way this document approaches those foundations is it's not black and white. It's not right or wrong. It's something that you have to use as a guide or a tool to allow you to feel comfortable with how you've guided the patient collaboratively to try to make that decision. But at the end of the day, if you're not comfortable with it, I don't think you should do it.
Yeah, that's great. That's very valid. And I think too, part of it, you can recognize that harm can come in different forms to different patients. So if you're leaning on the non-maleficence concept, you can recognize, like, is this going to cause more harm to this patient? Or is this something where, yeah, the patient has decided this is what they want to do. I think for this particular patient, that's fine, and I can respect that. Otherwise, referring out is absolutely always an option. Or even saying to the patient, these are the options that I have on the table for you. There are no other options that I have on the table that I can offer you, but if you are not comfortable with either of these, feel free to go out there, see if you can find somebody who can fulfill what you're looking for.
I agree. And I think it's also complicated in the sense that we're not looking at every possible factor in this scenario. So we haven't talked about the patient's financial situation. Are they not able to afford any other treatment? In which case, in some cases, it is the best treatment to remove the tooth to get them comfortable. But it's just, again, trying to explore all those options using these foundations, I think to me is very helpful.
Very good. All right, Dr. Yu, have you had any situations that you've run into, or that a colleague of yours has run into, where you could have drawn on these principles to help?
Okay, thank you, Dr. Walker. Instead of one specific instance, I'd like to elaborate on what the Foundations of Professionalism document means to me. When I was starting out in practice 20 years ago, I was working as an associate, and the principal dentist and I didn't see eye to eye on a few issues. And there were instances of unprofessional conduct, as in billing concerns and not collecting co-payments. And unfortunately, I didn't have the courage to have these difficult conversations with the principal dentist, and I ended up leaving the practice. In retrospect, I would have appreciated such a document to help me navigate through this difficult ethical dilemma. And if it had come out back then, I might have had the courage to have the difficult conversations. In my work in investigations at the RCDSO, I do see cases of dentists and office staff bringing information to the college about unprofessional behavior of other dentists in their office. And on one hand, I'm very impressed and I applaud their courage. And also, it also reassures me that the profession is heading towards the right direction. And I'd just like to leave with a comment from a bioethicist. I'd like to paraphrase his work. And he mentions that the society's trust in the profession is not based on the behavior of one dentist, but it's based on the collective behavior of all dentists. So we all have to do our part. Just a little reminder of that. Thanks.
Excellent. I guess I'll finish off. I can tell a little story about a patient that I once saw. And this story relates to patient autonomy. So I had a patient who was a young lady in her teens, and I noticed a pattern on her teeth that was consistent with the presence of lots of acid in her mouth. And I suspected that she may have an eating disorder. She'd recently lost a lot of weight. She looked very different from when she'd seen me previously. And that's a bit of a delicate situation to deal with. So on one hand, you have the principle of non-maleficence, because this could be a serious issue if it's allowed to, or if it continues on and she doesn't get the treatment she needs for this. But you also want to respect the patient autonomy, and you also want to keep the relationship you have with that patient and not push her away. So in our appointment, when I was talking to her, I told her what I was seeing, but I made sure not to accuse her of anything or make any assumptions that there's a chance she didn't have an eating disorder as well. You don't know. So I brought it back to general terms, and I said, you know what I'm seeing, based on what I'm seeing, sometimes it's caused by having a lot of acid in your mouth, or if you're sick often. Is this something that you've ever noticed or that you've ever experienced? And she denied it, as I thought she may. So what I ended up doing is I said to her, you know, there's other reasons you could have acid in your mouth. There's something called acid reflux that's pretty common. But maybe this is something that you should have checked out by your family doctor. Now, this patient was young, so her parents were in the waiting room during this appointment. So my options would have been, I could have talked to her parents, but in this case, I thought it would have violated her autonomy. And also, I wasn't sure in this particular situation how her parents might react. So I was worried about causing more harm to the patient if they went home and the parents reacted in a way that that might have been harmful to her. So what I ended up doing is I told the parents as well, like, I think like there's some issues going on here. I'm concerned they're ongoing. I'm concerned that there may be something, an underlying systemic issue that I think we need to talk to the family doctor about. And then I wrote a letter to the family doctor reporting the findings. And in that letter, I mentioned that sometimes this is consistent with an eating disorder. So the patient did go to see the family doctor because I think she didn't feel like she was attacked. The parents were supportive of her seeing the doctor, and she did receive some treatment. So since she's doing well. I've seen her a couple times as she's grown up, and her teeth are functioning well, and she seems to have fewer issues over time. So that's how I chose to take care of the situation, and that's how I drew on the principles to weigh the different things that were at stake and figure out how to move forward. So we also have some companion resources for this professionalism document, because we obviously couldn't fit everything into it that we wanted to cover, because there's a lot to this topic. So why don't we go through maybe Susan or Michelle, we can talk about some of the companion resources to this document that we are developing. Or Andrea, do you want to take that one?
Thanks, Erin. I think Susan is going to talk us through some of the companion resources and really just give our audience attendees a sense of what's there for them and how they might apply it. So Susan, I know you're just getting your screen organized.
There we go. Okay.
Perfect.
Thanks, Andrea. And so you should be seeing my screen now. I just want to confirm that folks can see it. It's got the Foundations of Professionalism document up. Yep. Okay, great. So we have a couple of documents that are on our website, and we'll share the links with you afterwards. Checklists are really helpful because when you get into material like professionalism that's got a lot of complexity to it, it can be really hard to remember all of the key pieces of information to consider. And so when you have the benefit of a one-pager, which really distills that information for you, it can really serve as a great resource. I like to print them off, and I'm not a big paper person, but for something like this, I would print it off and have it, on the wall of your office or by your desk or as a screensaver, something just to help guide you when you get into those tricky situations and you're trying to figure out what do you do and how do you manage your way through this. So I'm going to draw on one of the examples that was in the chat, and I just check, is the text size okay for folks to see, or should I make it a little bit bigger? As I can. Is it okay? Okay. So if you were thinking about a situation, one of the questions in the Q&A came in that said, well, what do you do if a patient is unsure between an extraction and a root canal? What do you do? What should you do? And how should you make this decision or help them make this decision? Because it's really not your decision to make. It's the patient's decision. So if you work your way through these 4 areas that are part of the document, start first with patient autonomy and thinking about the patient's choices. And so thinking about, the first one that I would really draw your attention to here is, have you provided clear, accurate, and understandable information? And that means really customizing that information to the individual patient. Every patient is going to be different. Sometimes your patient might be a colleague. It might be a fellow dentist who understands, well, what does it mean to do a root canal versus to do an extraction? What are all of the risks and benefits of both options? And how might you really want to consider that? And what sorts of language can you use that will speak to this person in a way that they can understand and really truly know what the implications of their decision are? Are you sharing the decision-making with patients and or their authorized representatives? So this is where we see, if you look to the RCDSO's website, where there's some information there about consent to treatment and how do you make a decision with a patient where perhaps they can make some decisions on their own, but other decisions they may need to have a substitute decision maker. And there are some legal requirements there for who is that substitute decision maker and has that person been involved in this conversation with you? Have you answered their questions? And so people will have all sorts of questions, and this is where it starts to get tricky. So remembering that when you're in the situation with a patient and you've gone in, make sure that the patient's not laying down in the chair, that they're sitting up and they can have a conversation, because there's already a power imbalance. You've got a dentist, a professional, and you've got a patient who is going to listen to what you're saying to them. And unless you have that level playing field and they're able to, really feel empowered to ask the questions that they have, and some ways that you can signal that is by sitting them up in the chair. If you're wearing a mask and maybe don't need to wear a mask at that moment, removing the mask so that you can have that visual and be able to engage in that conversation with them. Make sure that you're using words or terminology that is something that they can understand. If you've got diagrams that you can use to help show them what it's going to look like, or if there's videos or any other resources that you can have, what are some of the things that you can do to really make sure that you're respectful of that patient autonomy and you're doing everything in your power to help them understand and make a good decision. And then, of course, making sure that you are acting in accordance with legal and professional obligations. So that's going to include things like when you're looking at a hierarchy of substitute decision makers, who is it that has the authority from a legal perspective to be able to act in that patient or on that patient's behalf, and that your care is, of course, patient-centered. So that's that first section. If you think about the second section, though, so thinking about, are you acting in the best interest of the patient's well-being? So this is beneficence. So the things that you're offering, so the example that was given was, if the patient's not sure about whether to have an extraction or to have a root canal, well, some of that might depend. If the patient is 102 years, 103 years old, which is what my grandmother was when she passed, if she had gone into the dentist for a painful tooth, I can pretty much guarantee you that she would not have opted for a root canal at that point in her life. Whereas if somebody else is, maybe there's a tooth can be saved, and there's, otherwise there's indication in the patient's overall oral health that they're going to be able to manage this, and that they will be able to sustain the care that's required. That you're treating them with kindness, compassion, and respect. There was another question that came in through the chat that said, is this kind of like the golden rule, right? Which is that folks often will hear about, do unto others as you would ask them to do to you. And there's true, it is that, and it's more than that, because it's also making sure that you are acting in the interest of the patient, and you're offering care that is within the science. So regardless of what your personal beliefs might be, what does the science say? And that's where making sure that you're collaborating effectively with other healthcare professionals. The example that Dr. Walker gave a few moments ago, around the patient who perhaps had an eating disorder, maybe that was going to require, some conversation with the patient's physician. Maybe it might be a mental health practitioner. It could be others that you're involving in that patient's care, because in order to provide good oral health care or dental care, you need to think broader than that. So considering all of those things, making sure that that you're open and receptive and committed to understanding emerging issues. And I jumped down to this because maybe there is something in this particular example where the evidence is changing. I think it's pretty consistent. We've been doing the dentists have been doing root canals for a very long time. And so I think there's some consistent science there, but maybe there is new evidence that's emerging, or there may be new therapies that are emerging that are considered to be better than a root canal. I don't know what those might be, but if in your situation as a professional, being aware of what's in the evidence that you would need to consider. Then if we think down to the bottom left-hand side of this page around non-maleficence, so that's doing no harm. That's making sure that you are able to provide the care that is compliant with all of the legal, ethical, and professional obligations, that you're following the clinical standards and guidelines that are required of your profession, that you are thinking about just because you can doesn't mean you should. So there may be situations where it's somebody that has been in practice for a very long time, but maybe hasn't done a root canal in forever. Maybe they're not the best person to do that root canal. And so if the patient needs the root canal, then it might mean a referral to another clinician who's able to do that. Making sure that the information you're providing to the patient is truthful and accurate. Again, making sure that they're understanding, are you, and we see this sometimes where there may be groups of dentists working together, and they are all general practitioners, but they've evolved into some sort of small S specialties, where some people are seeing particular types of patients more regularly than others, all within the same practice. But making sure that the patient knows that you are a general practitioner providing this care, or if you are a specialist and you hold a specialty license, that they understand, who it is that's providing the care. Then thinking about, your responsibility. Ultimately, you are responsible, and Dr. DiSanto mentioned earlier, responsible for having the knowledge, skill, and judgment to complete the care that you are providing. And if you don't have that, it is up to you at any given time with any given patient to say, I'm sorry, but this is not something I can provide. Referrals, we've talked about that. Making sure that you're always looking at your patient's best interests in guiding your clinical and administrative decisions. So always thinking about, what's in this patient's best interest, and it could be a clinical decision, but it could be also thinking about their life in general, right? If you know that somebody has a big personal event coming up tomorrow, and this is not an emergency care, then maybe you say, like, let's put this off until after your family member's wedding that's happening tomorrow, or whatever it might be. So making sure that you're thinking about the patient more broadly. And then, of course, we know around maintaining boundaries and making sure that those boundaries and professional relationships are appropriate. Communicating objectively about your professional services using technology responsibly and ethically is really important, because as we get more technology, and one of the areas that often comes up is, well, what do we do with artificial intelligence? You're still ultimately responsible for the judgments and the decisions that you make as a clinician. AI is a tool that you may be using. And then, of course, thinking about any mandatory reporting, there have been a few questions that have come in through the Q&A tonight that do refer to some mandatory reporting. And so making sure that you're fulfilling your responsibilities around reporting when those situations may arise. And then balancing your personal and professional priorities to maintain your own well-being. If there's times where you're not able to provide the care for any reason, it's really up to you to declare that and to make that known to the patient. And then finally, the last area that's on the 4 quadrants is around justice and being fair. So making sure that you're complying with human rights and accessibility laws. There was a question that came in through the Q&A around, well, what do you do if a patient comes in and you don't have the equipment to provide the care for them because you can't position them safely given the chair that you have? So that it may be a situation where you can't provide that care for the patient, but what you do in that situation is help them to find a dentist who can provide the care, and that you maybe are able to bridge that until they're able to receive the care through that other dentist. That you're providing services that are free from prejudice and discrimination. And you'll see the other areas that are here, that you're promoting fair and equitable access to oral health care, recognizing and mitigating bias, and so forth. And here we have the power dynamics. I can't stress this enough, because anytime you end up with a clinician and a patient, there's always going to be a power dynamic. And so being conscious of that and reasonable in your approach, so that you're able to access that. So this checklist is on our website. We will share the link with you after tonight's call, but I do hope that you take a moment and go through it and review it. There's also a companion checklist that is intended for patients, and it uses the same 4 quadrants, and it presents some things that a patient might want to consider when they're thinking about the care that the dentist is providing to them, and is it demonstrating the professionalism that we would look for. So I really challenge meaning in a very nice way, appropriate way, challenge you to think about how you might get this in front of your patients and share it with them. We see this quite often where, we've got some great resources that are available, but they're not helpful if they sit on a website. So how might you make this available to patients and really encourage them to embrace this as being part of their role as the recipient of your care? So thank you for giving me a moment to walk through this checklist, and I will stop sharing my screen. And I think there were a few other questions that we wanted to talk through. So thank you.
Thank you, Susan. So Susan and Michelle, are there any questions from the chat that you would like to touch on, or any maybe common things that are coming up that we could clarify a little bit more for everybody who's here tonight?
Good evening, Erin, and good evening, everyone. I'm the policy lead for this Access to Care strategic project, and help support the working group in developing the document and the companion resources. I would be happy. We have a lot of specific questions about the scenarios and what if this, what if that. So we were thinking we might, if it's acceptable to you, Erin, have me share the patient companion resource for the audience. We can go through that and just show you the equivalent and a resource that we developed for patients. So let me just share my screen here. Here we go. Okay, so here, and we do have the link to our webpage with all of our tools and resources in the chat, and we can circulate the links after this webinar as well. So this is the patient version, and the way that it's framed is, what can you expect from your dentist? So as the college, when we write standards of practice or other documents for the profession, we tend to write them for the profession. Of course, in accordance with our mandate to protect the public interest, they ultimately do that, but they are often written to a dentist audience. So what we've done in this case is we've taken the content in the professionalism document and written it for the patient audience. So we're using more plain language and describing the duties and the principles in the professionalism document as what you can expect as a patient from your dentist. So I'm just going to scroll, and as Susan mentioned, we have the 4 quadrants here as well. So you can see which components in this document relate to the principles of patient autonomy, beneficence, non-maleficence, and justice. Those terms aren't used in this document, but you can see respecting your choices is patient autonomy. So the document, and I sure hope it's big enough. I'll make it just a little bigger so you can see the text a little bit better here. But we have here, respect your choices. So your dentist is required to listen to you and respond to your questions or concerns, involve you in decisions about your care, explain dental information in a way that you can understand. So this is ensuring that your communication is tailored to the patient and what their needs might be in terms of how they communicate with you. To get your or your substitute decision maker's consent before starting any treatment. So the corresponding obligation for dentists is to obtain consent for treatment before proceeding with the treatment. And to keep your personal health information private and confidential. So this is another key aspect of patient autonomy, where you have control not only of your decisions that you make about your health, but also about your personal health information and who sees that information. So then moving to the next quadrant, there is acting in your best interests. So this is beneficence. So your dentist is required to put your health and well-being first. So this is the idea of acting in the patient's best interest and prioritizing their interests and well-being. To create a safe environment, to treat you with kindness, compassion, and respect, to support you and collaborate with your other healthcare providers, to help you access emergency care. So this is either, on the dentist side, their obligation is to either provide the emergency care to you or to advise you where you can obtain that emergency care. And then to ultimately promote good oral health for you and for your community. So that's what a patient can expect from their dentist if they are practicing in accordance with the principles and duties of beneficence. So the third quadrant here is non-maleficence. So what can you expect your dentist to do with respect to this principle? It's protect you from harm. So your dentist is required to follow all laws, rules, and ethical standards that apply to dental care, to be honest about their qualifications and their skills. So they need to be clear, true and accurate in how they describe their qualifications, whether they're a specialist and have a specialty designation or not. You can expect them to refer you to other healthcare providers when needed. So this is a very important principle and duty that we already highlighted in terms of collaborating with other healthcare providers, and that could be dentists or non-dentists. Avoiding situations where their personal interests could influence the care they provide. So this is getting at conflicts of interest and ensuring that dentists manage conflicts in a way that prioritizes the patient's best interests. They will keep your relationship strictly professional. So this is getting at maintaining appropriate boundaries and ensuring the relationship is strictly professional. Using technology in ways that protect your safety, privacy and confidentiality, and quality of care. Take responsibility for their actions and inform you if they've caused any harm. So this is the obligation to disclose harm that may arise. And then to maintain their own health and well-being to provide you with safe, high-quality care. So this is an important provision in our document where we acknowledge that dentist well-being is important and will facilitate the provision of high, safe, quality care. So the fourth quadrant here is related to the justice bioethical principle. So your dentist, you can expect that they will follow legal rules about human rights and accessibility. So this is the Ontario Human Rights Code and the AODA, so the excessive, I can't recall the complete title, but it is referred to as the AODA, to treat everyone fairly and respectfully without bias or discrimination. So you can expect that from your dentist when you go to them as a patient. You can expect that they will recognize and prevent bias from affecting their relationship with you and their care. So there is an obligation in the document for dentists to recognize and mitigate bias and ensure that it doesn't negatively impact their professional relationships and the patient care that they provide. The next one is respecting your unique background and needs. So this also speaks to the provisions related to patient-centered care. So you can expect your dentist will ask you about your needs, your personal circumstances, and ensure that the care that they provide reflects those needs. The second to last here is support and empower you to make your own decisions. So this goes along with what Susan was saying earlier about there being a power imbalance in the dentist-patient relationship. And you can expect that your dentist will recognize that power imbalance and try to empower you and support you in making your own decisions. And then the last here is to try to address the factors that impact your health and well-being. So this is getting at the determinants of health and things that might be influencing your overall health and well-being, and dentists can take steps to try to address those broader factors that might be influencing your health. So the document ends with just some suggestions on how patients can be an active participant in their care. So emphasizing that patient-centered care is one of the key focuses of this document. So we're encouraging patients to ask questions. Don't hesitate to ask dentists about things you don't understand, and ensure that you have the information that you need. That helps build trust and ensures that you receive informed care. We encourage patients to read the Foundations of Professionalism document as well. So I did mention that it is written more for a dentist audience, but we encourage patients to read the resource itself, as it sets out what the college expects of dentists, and of course what patients, the public, and society expects as well. And then lastly, we have contact information for the college, so they can reach out to the college if they have any questions about the document, about what they or the college expects of dentists, if they have any concerns or questions, so they can reach out to us. So we've provided that resource there. So I will stop there. I'm going to stop sharing my screen. Thank you very much for the opportunity to highlight this resource, and we do hope all of the resources we've shared with you today will be helpful to you in your practices. So I'll turn it back over to Andrea. Yes?
Yeah.
Okay, thank you.
Yes, great. Thank you so much, Michelle and Susan, for taking us through those. And thank you to Erin, Bonnie, and Kevin and Nancy for a great discussion tonight. Really appreciate everyone, all of our panelists and speakers who took the time out of their schedules to join us. And thanks to all of you who joined us tonight, tuned in to learn more about the college's professionalism document. As always, if you have practice-related questions, we do have a practice advisory service department. Please do consider reaching out to them and getting assistance. We have practicing dentists in that department who can assist. You can follow the college's social media accounts, and you can see them here on screen. In terms of CE points, as a reminder, if you've stayed with us for at least 75 minutes of tonight's session, you're eligible for 2 Category 1 points, and we will send those through to you based on the records we have on Zoom, and I know many of you have asked questions about that for Susan. I wanted to flag though, following tonight's session, you'll also get a link for how you can earn even more CE points. They're here on the screen, and each of these steps really intended to support implementation and knowledge translation. You can get up to 5 Category 2 points, 1 point for each of these steps. So reading the document, discussing, we have FAQs. We didn't go through those with you tonight, but you'll have links to those. Download the checklist that Susan talked to you about. Think about how you can share the patient resource. And then lastly, sharing this recording. So please consider that. And we hope you can join us at future RCDSO Connect sessions. Our next one is taking place October 29th. You will get information about that this week for further details. And we're holding a special session on November 26th to talk about the PLP divestment. You'll hear at that session from College Registrar and CEO Dan Faulkner, who's going to provide a bit more information about the transition of the program to Navicord. Navicord is one of Canada's largest and fastest growing multi-line insurance brokers, and they'll become the owner and operator of PLP as of Jan 1st, 2026. So 2 great sessions. We hope to see you there. Thank you again, and good night.